Come in.
Hi, my name's Dennis. I'm the student nurse for today. Let me wash my hands here and provide us some privacy. We're going to do a GI assessment on you today, but first, before we get started, let me go ahead and just verify with two forms of identification. The first one would be a verbal. Can you go ahead and state your name and your date of birth?
Clifford Gray Pool, 4/17/49.
Okay, and I'll verify that with the second form of ID. It could be either like a patient ID tag. And then, okay, so today we're going to do a GI assessment, but before we get into that, I want to ask you a few questions. First thing would be a family history. Do you have a family history of like colon cancer?
No.
Okay, how about a personal history? Do you have a history of smoking?
No.
How about drinking? Do you drink?
Occasionally.
Okay. How about, do you have any recent history of antibiotic use?
No.
Okay, because that's important. We want to be sure because that affects the microbiota.
Mm.
Okay, how about, do you have any current pain right now in your abdominal area? Or, okay, how about your appetite? Has your appetite, do you have a good appetite?
Too good.
Too good, okay. Have you had any recent change in your appetite?
Yes.
Okay. How about any like recent, so you feel like, how's the change? Do you like eat more or less?
I've been eating
A lot more, okay. How about like weight gain or weight loss? Have you had any?
same thing, because of the virus and having to stay home, I have gained some weight.
Okay, that's understandable. Okay, how about like, do you ever get any like any kind of burning or like chest pain at all ever?
No.
How about any like after you eat, do you get any kind of pain, any gastric pain,
No.
or even like a couple hours after you eat, you don't get any kinds of pain? Okay, good. Okay, so we're going to go ahead and get into this assessment, and the order we're going to do is first we're going to inspect, and then we're going to auscultate, and then we're going to percuss, and then we're going to palpate. But we're going to palpate last. We don't want to do that before auscultating because it could change bowel tones and it could cause pain. So first, let's go ahead and do the inspection. In the inspection, we're going to have the patient be completely flat. And we're going to note the contour shape of the stomach, note that and document, and then we're going to look for any lesions, any masses or hernias, and then we want to note the color, like we want to note adverse colors such as yellow, which could be a liver problem, or a colon sign, which is purplish discoloration around the umbilical area, which could be signs of internal abdominal bleeding. And then we want, like, note on a skinny person, you may note any a pulsation, but it's not normal on a normal size or normal weight person. It could be a sign of an aneurysm, so it should be further investigated. So then, now we're going to move into the auscultation. And auscultation, we're going to start we're going to hit all four quadrants. We're going to start in the right lower quadrant and work in a clockwise manner. So we're going to listen with the diaphragm of the stethoscope. We're going to listen for like it could be low to high pitched gurgling sounds. And we're going to listen, and the normal should be between 5 to 30 within a minute. And you want to note whether it's hyperactive or hyperactive. And then to verify whether there's no bowel tones, you want to listen for a full 5 minutes. So we'll listen. And so you go all the way around. And then we want to take the bell part, and we want to listen for over the arteries and listen for possible breweries. And then here we want to go over the aortic artery here, and it's going to be more of a squishy noise. And then we want to go over the renal artery, and the iliac artery, and we could go down further to the femoral artery on both sides there. Okay, so then after that, we're going to go ahead and do percussion. And percussion, it should be, you're going to go ahead and just tap on your finger, and you'll notice the dominant the dominant noise should be more tympani, which would be more air in the intestines. And you'll note areas of dullness over like the liver, or over the stomach, or full bladder, or you want to note areas. It can also be caused by ascites, which is a fluid inside the abdominal cavity, and that will cause dullness too. And then after that, then we're going to go ahead and go into palpitation. And we just want to do a light palpitation in a circular motion and work our way around. And we just want to note for areas of tenderness, guarding, or any masses, and be sure definitely do not palpate over areas of where you suspect bruits or you see pulsation like that. And you want to report that to the doctor right away. Okay, thank you.